So I get this question a lot, that what's going to happen to my body once I start testosterone replacement therapy. So I have talked about the benefit of testosterone replacement therapy and optimizing your testosterone level. But if you're just starting out the testosterone replacement therapy for the first time, you're not going to see the improvement in all the symptoms right away. 3 weeks after starting testosterone replacement therapy, you'll see improvement in your sex drive, improvement in your overall sexual desire. For male patient, you may also start seeing stronger erection and also morning erection. If you're regularly going to gym and lifting weight, you will see that your strength's going up. You're able to lift more weight or able to perform more exercises within same period of time. 4 to 6 weeks after starting testosterone replacement therapy, you see improvement in your overall mood. Symptoms of depression improve, symptoms of anxiety improves. You also see improvement in the quality sleep. You feel rested the next day after getting a good night's sleep. 3 months after starting testosterone replacement therapy, you start seeing improvement in your lean muscle mass. Your strength goes up significantly. You start losing body fat and your body composition starts improving. You start looking better, your overall metabolism improves and your overall metabolic health improves. After 3 months, you'll also have better glycemic control. So you won't have a insulin spike or blood glucose spikes a lot. You'll also see improvement in your blood pressure. And 6 months into the treatment, and after optimizing your testosterone level and everything around testosterone, including estrogen, you will start seeing improvement in your bone strength. Your bone mineral density improves. We have seen this with DEXA scan, where the bone mineral density of patient improved after starting testosterone replacement therapy. So if you're just starting out testosterone replacement therapy, make sure you stick to the therapy and talk to your provider on what symptoms are improving, but don't expect all the symptoms to go away within first month or 2 months. So make sure you stick to the therapy and talk to your provider. If you have more questions, comment below.